Hello everyone, I am so excited to share this with you. I got my nurse pack in the mail, at least I think it's my nurse pack. It's from UTA Con High, so I wanted to share this exciting moment with you, so let's open up the box and see what's inside. It's my nurse pack. Oh. That is it. Okay, let's take our list and let's make sure we have everything in our kits, because you're going to need everything in here to be successful this semester and in the program. Okay, I might not go in the exact order of your list, but I'm going to at least go through the items and tell you what they are, and make sure that we put a name with a face of the items. That way it's a little bit easier to distinguish that you have everything that's on your list. Okay, here we go. Start with the big things. So these two items are your Foley insertion trays, and you should have 2 of those in your kit. Put these right down here. This is 1 roll of tape, medical tape, not Scotch tape. And then you have 1 box of alcohol prep pads, and you will be using those probably throughout your 2 years. These are bathing cloths that you will be using for Bed Bath & Beyond in the skills lab. And so they're cleaning cloths. There should be 8 in here. We have 2 yellow PPE protection gowns and 2 face masks that you will also wear as a part of your PPE. And this is your practice injection pad. You will be practicing giving syringe loaded medications. Exciting. You have some dressing scissors that you will be using not only in the lab but in the hospital setting. This little box has your calculator, your UTA approved calculator. And I'll open that up. Just a basic calculator, and you can use this during your exams as well. There we go. This is a oral care suction. I call it a suction swab. You attach it to suction, and you can provide oral care, and it can also suction secretions so that the patient doesn't aspirate. No questions here. Toothbrush and toothpaste for oral care. This is a really interesting device. This is an ostomy collection pouch, and this is used when a patient has a colostomy or an ileostomy, and it gathers the drainage, and there's a clip that contains it. Along that same theme, this is not for target practice. This is an actual, goes this way, measuring device that you can use to measure the size of the ostomy when you're applying a collection bag. This is a central venous catheter dressing change kit, which is sterile inside there, and it has all the items you need to successfully change a central venous catheter dressing. This is a 60 cc or 60 milliliter syringe that you will use with your NG tube. Speaking of NG tubes, this is your Salem Sump dual lumen stomach tube, or nasogastric tube, as most of us call it, an NG tube, and it's a 14 French. You'll have 1 of those. We have 2 abdominal pads that have a blue line on it, so that's how you know that's what they are, and they say ABD on them for abdominal. We have 1, 2, 3, 4, 5 4x4 gauze dressings, 2 SureSight window dressings. You'll hear most of us nurses call this a tegaderm dressing, but this is used primarily when you do a sterile dressing change for your central lines. Very important, sterile gloves. I believe on your checkoff list they're called Nitroderm or nitrile powder sterile gloves, and you will need to get a size that fits you, so make sure that it's the appropriate size. And 1, 2, 3, 4, 5, I believe you're to get 5. I have 6 here. Bonus. And this bag of goodies has most of your items that will be used for medications, to learn how to administer and prepare medications. Let's see what's inside. Okay. Little organization here. Never hurts anybody. Okay. Let's see. These look to be mostly syringes. These, there are two 3 cc or 3 milliliter Lure-Lock syringes, and Lure-Lock means that they actually attach by twisting them and tightening them onto the intravenous device. So there are 2 3 cc syringes and 2 5 milliliter or 5 cc Lure-Lock syringes. And we have 10 milliliter or 10 cc Lure-Lock syringes, and there are 2 of those. And you have different sizes of syringes based on the volume of fluid that you're going to draw, the volume of medication to administer. But you'll learn that later. These are what we call combo packs, and these include, there's 2 of them. These include, I'm going to take them apart, 3 milliliter or 3 cc syringe, a 3 cc syringe, and a 21 gauge 1.5 inch needle. So both of those items are in this pack, and there are 2 of those. Let's see, we have, these are, most of the time in most hospitals you'll see TB syringes, and they have blue. They're packaged in blue. It's kind of the universal color for TB syringes, and they already have their needle with them as well. So it's the syringe and the needle for TB syringes. And there are 3 of those. And we have these are insulin syringes. A lot of times these will be orange. Almost any time I've been in a hospital, they're with an orange cap or orange packaging. And there are 3 of those. These are 1 milliliter insulin syringes, and they're 29 gauge, 1/2 inch. And they have that orange cap. So TB syringes are typically blue, and insulin syringes and needles are typically orange in color. So there are 3 of those. All right. This is called Practi Powder, and when you get to an assigned week in clinical or in the skills lab, you will be combining the Practi Powder with a certain amount of saline to reconstitute the powder, and then you can practice drawing it up with your syringes. But this yellow, it's got the yellow powder, practice powder. And then this is your normal saline, 30 milliliters of normal saline. Normal saline is otherwise known as 0.9% sodium chloride. So there are 2 practice medications in here. These are not real medications, so don't administer them to animals or people, just for practice. And we have in this little green package, this is what we call a filter needle or filter straw. And let me make sure, yes, filter straw. And it is it doesn't say, 18 gauge, 1.5 inch. And what we use this for is when we have ampules, which are in this little bubble wrap here. So don't squeeze these. These are glass ampules. You should have 2 of them. We break the top and we attach the syringe to the filter needle, and then we insert the filter needle in the ampule, and what it does, it filters out any possible micro shards of glass so that we're not injecting that into the patient. So anytime you break an ampule and you're going to draw it up, you must use a filter needle, and that's what this is. And these are glass ampules, and I'm not going to open them up because I want them to stay protected, but there are 2 glass ampules, and some medications do come in ampules within the hospital setting. So we'll also be teaching you how to safely and appropriately open these and withdraw your medications from them. So there's 2 of those. We have a 20 gauge, 1 inch needle, hypodermic needle. There is 1 of those in your kit. There's the front. This is a twin pack, and this actually has what we call a blunt needle, which is this red end, and that is again kind of the universal color for any blunt needles. I'll be showing you another one here in just a second, but this is a twin pack. It has a blunt needle to draw up your medications, and then it also has a needle on this side. So I call this the Christmas pack because red and green, but officially twin pack. So that's what this one is. And we have your 22 gauge, 1.5 inch needle. This type of needle we would be using to give intramuscular injections. So it has the little safety glide, safety shield on here, but that's what this looks like. There's 2 in your kits, and that's what that looks like. That is what is included in your nurse pack for the on-campus nursing foundations course. All of those things I just went over. If you are in the AO or online program, you have a few different items, and that is what these are. You have an additional dressing or abdominal dressing change tray that has all the items you would need to change a dressing. So that's this one. And then, remember how I talked about the blunt needle, how that was red, kind of the universal color? Here is a blunt needle, a bigger one. It's just a different kind. And the reason these are blunt is because the tip is not as sharp as needles you administer medications with, so that if you accidentally stab yourself with this, it will not pierce the skin. I know that as a fact, but it hurts like the dickens. So try not to ever poke yourself with these. But they're blunt because they are made so they will not pierce the skin. So again, that red color, and there's the front. So again, this is the AO online program that has those. And you have a 3cc 21 gauge 1 inch Venous point syringe as well. I think you have 2 of those in your kit. And then you also will have a box of non-sterile gloves, utility gloves. And those are the additional items if you're in the online program. So be sure when you get your kit to use this video to help you identify what's in it, but use your list. There's the on-campus, there's the online. Utilize your list like an invoice and go through it and make sure you have everything. And if you find that something is missing in your nurse pack, please contact the UTA bookstore and they will help you to obtain anything that might be missing. So if you do have any questions, please be sure to ask your clinical instructors. And don't those all look exciting? we're going to be learning how to use all of those, the tools of the nursing trade. Have a good day.